This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning, everybody. So, kind of quick medical minute. We, probably see a lot of patients who are on what we call the DOACs, the direct oral anticoagulants. We used to use a lot of Warfarin. Now we've obviously transitioned to using a lot of things like Eliquis and Xarelto. We start them mostly in the emergency department for DVTs or PEs, and it's a really nice alternative because people don't need to use Lovenox. They don't need to use any injections. They can just go right on the pills. We can discharge them more easily than we used to when people had to take Lovenox and Warfarin initially. But is there a difference between the two main ones, the Xarelto or the Eliquis that we use? There's really not been head-to-head trials comparing them, so a lot of people kind of just assume they're about the same in terms of the recurrence of clots or the bleeding risk, but there have been a couple of really large observational trials recently that compared the two. They basically looked at these databases, and one trial, specifically the one mentioned briefly here, looked at 18,000 patients who were newly prescribed either one of those, Xarelto or Eliquis, for DVT or PE, and they found that there was one that was particularly better at both preventing recurrent clots and a lower risk of bleeding, and that one was Eliquis. And there was another trial that looked at a different patient population, and it showed kind of the same thing. So kind of, I thought, surprising, two trials, two very large observational trials that showed that there was some benefit to Apixaban or Eliquis in terms of less recurrent clots and less bleeding. So if I had to pick one, that's probably the direction I would go at this point. There is a large or planned kind of randomized trial comparing them head to head. Unfortunately, the enrollment won't be finished until 2023. So it's probably gonna be several years before we have any other good data. So for now, this is kind of what we have. I don't think it's, dramatic enough to stop using, the other one, Rivaroxaban, altogether, but, it is kind of interesting. Any questions, comments? All right, thanks.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.